Hello. In this video, I am going to discuss the importance of lymphocyte immunization therapy for couples who have IVF failures and how immunization therapy plays an important role in this treatment of so-called unexplained implantation failures. One day, I received a call in the evening from one of our patients. She said, Doctor, I am thankful to you. I I delivered yesterday. I had twin babies, and I am the success of my pregnancy is because of your lymphocyte immunization therapy treatment. I had 6 IVF failures before, and after I took the treatment of lymphocyte immunization therapy at your center, my pregnancy was successful, and yesterday I delivered successfully. But I just want to ask you one question, doctor. What would have happened if I was offered this treatment earlier, even before I had so many IVF failures? So, friends, this is a common question that is asked to us by our patients that after how many IVF failures should we consider lymphocyte immunization therapy? So I am going little more into details of this, and this video will be sort of an answer to this question that we often get from our patients. I am Dr. Mohan Rao. I am a practicing gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut Centers for Reproductive Immunology in Mumbai, Pune, Nagpur, Bangalore, Hyderabad, and Delhi. And at these centers, we treat couples with unexplained repeated miscarriages, unexplained infertility, and unexplained recurrent IVF failures using immunomodulatory treatments. We give the active immunomodulatory treatment of lymphocyte immunization therapy or ImmuLIT, followed by a protocol of passive immunomodulatory medications. Now let's come to our topic and role of lymphocyte immunization therapy in IVF failures. Now you all know that the problem of infertility is really huge. 15 to 17% of couples suffer from the problem of infertility. There are various reasons for infertility, and if we find out the underlying cause, then we can do the treatment accordingly, and patient can conceive successfully and have a baby. Now, in a significant number of patients who have infertility, many a times all the reports are normal. Every treatment that is done is not successful, and then we label such patients as unexplained infertility. Also, patients who undergo IVF, almost 10% of them face the problem of recurrent implantation failures. That is, 3 or more times the IVF cycles don't succeed. Many a times patients undergo more than 3 cycles and still they don't succeed and they never conceive. Sometimes they conceive after IVF but they undergo miscarriage. Now, in these so-called unexplained IVF failures or unexplained infertility, it is very difficult to know what is the exact cause. Now it is known that in these so-called unexplained repeated miscarriages or recurrent IVF failures or unexplained infertility for that matter, the underlying cause can be immunological. And by immunological, what I mean is the allo-immune problem. Now you all know that pregnancy is formed by from 50% from mother and 50% from father. The part which comes from father is totally foreign to mother's body. So the pregnancy is genetically or immunologically different from the mother's body. So it is really interesting to know how come this immunologically different pregnancy survives in the mother's body for 9 months without any immunological attack, because otherwise our body doesn't accept anything that is foreign. For any transplant, you require thousands of investigations and medications so that the transplant continues. But this physiological natural transplant grows without any problem, without any medications usually. But in some, and this is because the pregnancy has a special immunological protection in the mother's body, and it is through certain protective antibodies called the blocking antibodies and protective cells called as T regulatory cells. But in some cases, this natural protection doesn't function properly. Either there are no protective antibodies or their level is low, the T regulatory cells are low. So in these patients, the immunological protection of pregnancy is not up to the mark. And in these cases, there are chances of reproductive failures. If this response is very early, then the implantation process suffers and patient doesn't conceive, and then we label this patient as an implantation failure. This becomes more evident when the patient undergoes IVF, because in those cases we can monitor, we know that there was a live pregnancy inside and there was no implantation afterwards. If this problem occurs little later, then the pregnancy results, and then later on it ends in a miscarriage. So here we are talking about the unexplained IVF failures. Now these are the patients who have unexplained infertility. So what is the line of treatment that is offered to these patients? So they undergo the complete workup of infertility. So ovulation is proper, sperm count is okay, the tubes are fine, uterus is okay. So they are offered maybe a few cycles of intrauterine inseminations or IUI. Now, if these IUIs don't succeed, then many a times, and if the ovarian factor and the sperms are normal, then these patients are advised the process of IVF. Now, here one important fact to remember is these patients of so-called unexplained infertility, we don't know the underlying cause, and then we advise them to undergo IVF. Now, if they have an immunological problem which is preventing conception in these patients, then it is highly likely that these patients who will undergo IVF will also face the similar problem in the IVF process. Because when we put in the embryo inside, there are chances that because of this immunological incompatibility, the implantation process will also suffer, or there might be very early preclinical miscarriage which results in failure of the IVF process. So the patients who have IVF failure with unexplained infertility, there is high chance of this immunological problem as a cause for failure. Now, if this patient undergoes one more cycle, there are again good chances or very high chances that the cycle will fail, and this keeps on repeating. And that's how the patient whose story I told you in the beginning of 6 IVF cycles landed up with multiple implantation failures. So, what should be done for these patients then? Is there any solution for this? Can we alter the immunological response so that the pregnancy is accepted? So, yes, it is possible with the help of immunological treatments, and this field of gynecology with related to immunology is called as reproductive immunology, and reproductive immunology offers solutions for these couples who have unexplained IVF failures. So yeah, of course, so also those who have unexplained miscarriages, but we'll just focus on recurrent IVF failures in this video. So now these patients who have unexplained infertility, I think we have to think from the beginning itself. The most important thing here, if we know that this patient has unexplained infertility, then we must rule out immunological problem in that couple. Because if this patient is going to go for IVF, she is going to face similar problem. So this is the first stage, you can say, of intervention or immunological intervention for couples who have unexplained infertility who are going into IVF. So that is you find out whether there is an immunological factor in these couples, and if it is there, you correct it even before the patient goes for IVF. So for that question of after how many IVF failures should I consider IVF, I would say even before the first IVF failure, if you consider immunological treatment, if it is indicated by the investigations, then that can save IVF for at least some patients who are going to face problem of IVF failures because of immunological factor later on. So this is the first step. And yes, how do we know that this patient has an immunological problem? So there are a set of investigations. I am not going into the details. We have explained this in our previous videos about what investigations that are required that will help to select a couple who will be benefited by the immunomodulatory treatment. But I will tell you a few, and what we do also I will tell you a little later. So we do important three investigations immunologically, that is the lymphocyte cross match, the peripheral blood natural killer cells, and the cytokine TNF alpha. Along with that, we do anti-thyroid antibodies also, anti-TPO and anti-thyroglobulin antibodies. Now, the interpretation, the reports of these tests are interpreted to find out whether there is an immunological cause, like a negative lymphocyte cross match will indicate that the immunomodulation will be beneficial. The changes in alterations in natural killer cell, increase in NK cell activity will be responsible for the immunological factor. Increase TNF alpha, the inflammatory cytokine, is associated with immunological problem. Raised antithyroid antibodies do impact pregnancy, and we have to uh, take care so that their impact is not there on pregnancy. Yes, antithyroid antibodies otherwise don't require treatment from the thyroid point of view, but to prevent their impact on pregnancy, lymphocyte immunization therapy with followed by immunomodulatory medications play an important role. And what we do for these patients? Yes, we give them the active immunomodulatory treatment of lymphocyte immunization therapy, or what is known as ImmuLIT, which is a patented and branded process that we do at our different centers. And it's a 3 hour one-time procedure where we uh, collect husband's or donor's blood, separate lymphocytes by a special patented process, and inject these cells into a wife to cause immunomodulation. And after that, after a period of 4 to 8 weeks, we ask the couple to plan pregnancy whichever way it is required. If IVF is required, or some who can conceive naturally, they can do that. So coming back to our question, when are we going to give the ImmuLIT treatment? So first thing I told you, that was after IUI failures. So after IUI failures, if we find this problem, we can give the treatment of ImmuLIT to that couple. Subsequently, the couple can plan naturally or using ovulation induction, and if required IUI, to plan pregnancy. And a significant number, those who have only immunological problem, will be successful with this line of treatment. The second situation is, now the patient has infertility, patient has undergone a cycle of IVF, a cycle or two you can say of IVF. Now the IVF specialist is sure of the egg quality. Egg quality is excellent. Sometimes even the genetic testing is done. So then you have ruled out genetic factor also. The endometrial lining is good, endometrial thickness is good, and which is conducive to implantation. The endometrial cavity is good, adequate, and there are no problems, no adhesions inside. So if these three, endometrial blood flow is good, then if these factors are favorable, then the pregnancy should happen or IVF should succeed. So in spite of that, if there is no success, then it is advisable not to wait for longer time. Okay, so it is important not to make this patient of one IVF failure into a patient of recurrent IVF failure with three or more IVF failures. So after uh, one or two embryo transfers, if the doctor, IVF expert, is sure of all factors, other factors being normal, then it is important to recommend or consider the immunological treatment of lymphocyte immunization therapy and other immunomodulatory treatments. So the second situation where IVF can be considered is where lymphocyte therapy can be considered is when IVF is not successful for a cycle or two, where everything else is normal. Here it is important to remember that even if there is one factor which is responsible, which can cause IVF failure in the factors that I mentioned, the immunological problem or allo-immune problem can coexist. So we have to keep that thing in mind. So in spite of correcting the problem, what is getting good quality embryo, sometimes if the egg is not good, a donor egg is used. So we ensure that the embryo quality is good, or PGTA is done. So if that is also considered and still if there is no success, then there is no point in recommending the same treatment again and again. So this is the first scenario, second scenario where one or two IVF failures. I would say even one good IVF cycle which has not been successful, and if the doctor is sure that he or she has taken care of all the other factors, then immunological factors should be considered at the earliest. So this is the second scenario. The third scenario where when lymphocyte therapy can be recommended is when the patient comes with recurrent IVF failures. Now that is three or more implantation failures. Definitely these patients are the patients to be investigated for immunological factor, and then to recommend, if the reports indicate, immunological treatment of lymphocyte immunization therapy or ImmuLIT followed by immunomodulatory medications. Because if they have three failures and everything is normal, there is no point in doing the same thing again and again. Here, one important thing to remember, that if three cycles are apparently good, and if still fourth cycle is being recommended, then I think there has to be a solid reason to do the fourth cycle, so that whatever has not been done before or what was not good before, then only fourth cycle is recommended. But here I would like to tell one thing, that IVF doctors are intelligent, and so they are always thinking for the good of the patient. So by third cycle, they have considered all the possibilities that will help the patient to succeed. And then maybe even after up to two, that is possible. But at least by three, they have already considered all the factors. So then it is important to consider the immunological factor at this stage. And at this stage, they have to consider immunological factor and investigate the couple, and if required, recommend the treatment of lymphocyte immunization therapy followed by immunomodulatory treatments. Now, there is fourth now scenario. This was the third one. The fourth scenario is couple who has undergone IVF, conceived, and the couple has miscarried. Now, this is also very commonly seen problem, that the patient conceives but ends up in biochemical pregnancy. Patient conceives, ends up in first trimester miscarriage. So the 60 to 70% what the success of the IVF procedure, the implantation converting into pregnancy or beta HCG positive, is lost by almost like one third of it in this process of pregnancy loss. So miscarriages after IVF is also a big problem. And therefore, in such cases, I think we have to consider immunological problem very early. If there is one IVF failure and the patient has conceived and miscarried, it is very important to rule out immunological problem and consider the treatment of lymphocyte immunization therapy at this stage itself. Here I will say, if the doctor has done everything, genetically embryo is good, lining is good, blood flow is good, and still the patient has miscarried, then definitely after one IVF and miscarriage, immunological factor should be considered, and if it is present, lymphocyte immunization therapy should be considered. Now, so this is the fourth scenario. Now there is one fifth and final scenario. This is very interesting. Sometimes patients call us and say, Doctor, do I have to take lymphocyte immunization therapy again? Now these are the patients who had problem of unexplained infertility or recurrent implantation failures before. They have undergone investigations and they had been given lymphocyte immunization therapy and they had successful pregnancy. Now after 2 years or 3 years, they want to try again. Now these are the patients, in many a times they may have the immunological problems still persisting. Of course, there are cases who subsequently conceive naturally, they don't require any support, any immunological treatment, nature takes over. But there is still a significant number of couples when they want to plan, when they try second time, again the immunological problem comes up. So it is in these fifth group of patients where they have successful pregnancy after lymphocyte immunization therapy first time. They they may need again the lymphocyte immunization therapy, so they should be investigated for immunological problem, and if it still persists, then lymphocyte immunization therapy should be considered in these patients before they may undergo IVF failure or implantation failure in the subsequent cycle. So, friends, I have told you five scenarios where the IVF should be considered, where lymphocyte immunization therapy should be considered in patients who have IVF failures. I will just repeat. First, even before the patient lands up with IVF failure, if patient has unexplained infertility. Second, patient has one or two IVF failures and all other factors that are required for success of IVF are normal or within normal conditions according to the IVF specialist. Third, if the couple has three or more IVF failures, patient has recurrent implantation failures, the lymphocyte immunization therapy must be considered. Fourth, a patient who has conceived after IVF and has miscarried. This has to be taken very seriously. As I said, almost one third of patients who have succeeded with IVF end up with a miscarriage. So therefore, the success rate of 60% goes to 40%. So therefore, if patient has succeeded with IVF but has miscarried, it is advisable not to wait for more than one cycle even, and to rule out the immunological factor in such cases. And the last group of patients is those who have succeeded before with LIT and they are planning and with IVF, and they're planning now second baby with IVF. So before that, it is important to investigate them, rule out immunological factor. If it is there, give them lymphocyte immunization therapy. So friends, I think it is very clear from this video that the aim of immunological treatment is to prevent IVF failure. Okay, so if the unfortunately patient has gone through IVF and hasn't succeeded, it is important for us to know all the possible factors that have led to the failure of IVF. And yes, we do consider, all IVF doctors do consider all the factors. They look for rare factors also. They look for the endometrial receptivity. They check for the genetic, the doing PGTA for the genetic status of the embryo. So all these factors are considered, and so that the recurrent failure of IVF or implantation failure is prevented. So in this group of all tests which are done so that the patient succeeds, it is important to remember the immunological cause, and it is a complementary treatment to the treatment of IVF. And I am sure if we consider this treatment in time, then we will definitely help patients to prevent subsequent IVF failures, because in our practice we have seen this many times. I remember a patient who had five IVF failures, never conceived. Then the immunological treatment showed that the patient had immunological investigation showed immunological problem and they were treated with lymphocyte immunization therapy. Subsequently, the IVF expert transferred 4 embryos and all 4 got implanted, which they had never implanted before in the 6 cycles. So they required embryo reduction. There are patients who have done this even before doing the IVF cycle. There are certain IVF doctors who send these patients who have recurrent IUI failures to us to rule out genetic after ruling out immunological other problems. And if the investigations indicate they have been given lymphocyte immunization therapy and they have succeeded even before first IVF cycle. So, in conclusion, I would like to say that IVF is an excellent treatment and it is helpful for couples who really face problem or difficulty in conceiving because of different problems. IVF is also offered to couples who have unexplained infertility, where all other factors are normal. So it is in this group of unexplained infertility, there is high possibility of immunological problem and they should be investigated for immunological problem at any stage when the patient comes to you. We must rule out this factor to help patient take care of this immunological problem as an underlying cause for the subsequent failure. And I am sure with this approach, the chances of success of IVF will definitely increase, and then we won't have to face this question from our patients that doctor, why I was not advised this treatment before. So there is no answer to this question because all of us, all doctors are working for the betterment of the patient, and if we consider in these situations the lymphocyte immunization therapy or the immunological factor, then I am sure we will help these couples achieve their dream, as I always say, achieve their dream of having their own baby. Thank you very much. And if you want more information about this, you can contact us on our helpline number 9833201522. You can also visit our website www.icprm.in. At our reproductive immunology centers, we treat all forms of infertility using immunological treatments. We don't do IVF at our centers, neither we do fertility treatment. And all these patients whom we treat are referred to us by our doctor colleagues or IVF expert colleagues. And after this treatment, the patients go back to their centers or to respective doctors for the fertility treatment, and the successes or success data what we receive is from our friends which we share with you here. Thank you so much.